Xerostomia is defined as dry mouth resulting from reduced or absent saliva flow. Xerostomia is not a disease, but it may be a symptom of various medical conditions, a side effect of radiation to the head and neck, or a side effect of a wide variety of medications. Causes of xerostomia. There are several possible causes of dry mouth. Side effects of some medicines. Hundreds of medicines can cause the salivary glands to make less saliva. For example, medicines for high blood pressure, depression, and bladder control issues often cause dry mouth. Disease. Sjogren's syndrome, AIDS, diabetes, anemia, depression, nutrient deficiency, autoimmune disorders, Parkinson's disease, and kidney disease can also cause dry mouth. Radiation therapy. The salivary glands can be damaged if they are exposed to radiation during cancer treatment. Chemotherapy. Drugs used to treat cancer can make saliva thicker, causing the mouth to feel dry. Nerve damage. Injury to the head or neck can damage the nerves that tell salivary glands to make saliva. Xerostomia symptoms. So, now let's talk about the symptoms of xerostomia. Symptoms of xerostomia may include a sticky, dry feeling in the mouth, trouble chewing, swallowing, tasting, or speaking, a burning feeling in the mouth, a dry feeling in the throat, cracked lips, a dry, rough tongue, mouth sores, an infection in the mouth. There be other symptoms that we did not mention in this list may present. Treatment of xerostomia. Dry mouth treatment often involves several steps. First, your healthcare provider will review your medications in case they could be causing your dry mouth. You may be able to take a different drug instead. If not, you can try the following steps to ease dry mouth. Avoid decongestants and antihistamines under your doctor's advice. Sip water before swallowing capsules or tablets. The water moistens your mouth. Try easy-to-swallow formulas, such as liquids. Avoid under-the-tongue forms. Even if you think a prescription medication is causing your dry mouth, don't just stop taking it. Talk to your healthcare provider first. For xerostomia, your healthcare provider may prescribe cevimeline to treat dry mouth in people with Sjogren's syndrome, pilocarpine to increase your natural saliva production. Researchers are continuing to work on ways to repair damaged salivary glands. They're also developing an artificial salivary gland that can be implanted into the body. Be sure these medical treatments are ordered and supervised by a legal doctor, because some of these treatments may worsen your other medical condition. Xerostomia home remedies. There are some home remedies options for xerostomia condition. Avoid caffeine. Caffeinated beverages can be dehydrating. Limit alcohol use. Alcohol may dehydrate, which can contribute to dry mouth. Stop smoking. Smoking tobacco can also dehydrate. Cutting down or quitting may reduce dry mouth symptoms. Drop sugar. Like caffeine, alcohol, and smoking, sugar may dehydrate you. Sucking on a sugar-free candy may provide some short-term relief from a dry mouth. Sugar-free gum can also provide short-term relief from dry mouth. Also, some gum contains xylitol, which helps stimulate saliva production. Use alcohol-free mouthwash. Avoid breathing through your mouth. The gel or juice inside aloe vera plant leaves is moisturizing for the mouth. Thanks for your watching. Please take care and stay safe.